Hey, greetings to everyone on the phone. We're going to go ahead and get started. Welcome to our webinar today about how healthcare can drive higher patient care levels. And more specifically, we're talking about technologies and technology trends in healthcare that affect patient care and how those can positively affect patient care. Just a little bit about Advizex. We're a company that helps IT bring new technology processes and organization to the way they operate so that they can enhance the value they bring to the business. So we sell technology, we help implement that technology and improve processes, both around the technology and just IT operational processes, as well as help with organizing to most effectively serve your organizations. But really excited to be here today. My name's Brett Wade. I'm a principal consultant with Advizex. We'll hear from a couple other folks from Advizex, JD Martino and Alywn Santos later in this conversation. But again, today I'm going to be talking to you a little bit about some healthcare trends. And so really, if we look at what's been going on for the past 7 months and how it's impacted healthcare and sort of some of the trends you see around that, during what we thought was the pinnacle of the COVID pandemic, certainly it's still sort of ongoing. Some needs immediately became spotlighted around the need to share more data, figuring out how to make things secure, but still be able to share data. And a lot of hospitals were also faced with working through remote workforces. So a lot of scrambling to do things differently in a sort of post-COVID or during a COVID world. We certainly go across the gamut, see hospitals looking on ways to recover their revenue. Telehealth continues to explode. At the same time, a lot of the age, or not age old, but some of the more recent trends in healthcare continue to persist, right? The consumer-driven consumerization of healthcare continues to be a big issue. Healthcare professionals are still talking about the social determinants of health. Health equity has certainly popped up a lot more in current conversation. AI continues to be getting traction. Precision medicine continues to be getting traction. And what we see when we sort of look across the landscape at all these things that are going on in healthcare is we really see three trends, overarching technology trends that are emerging. First of those is really innovating on patient engagement, right? So the goal here is really how do you engage with those patients? How do you get those patients coming back to your facilities and then being more engaged with their health? And how do you as a healthcare provider connect with those patients? The other continues to be around data sharing. We've got more data in healthcare today than ever before. That continues to grow. And so there's still the question of how do you get access to the appropriate data to be able to do your job, and for healthcare professionals to be able to leverage that data is really point number 3. So maximizing that data use. So once you get access to that data, how are you able to leverage that data to actually improve care outcomes? So the thread of all three of these are really that technology is playing a key role in determining how healthcare solves these challenges. I'm going to dig into each of these a little bit more. First, I'm going to talk about innovating on patient engagement and what that means from a technology perspective. So, right, when you look at telehealth, I think the real key things to call out are that it's here to stay. Most folks agree on that. From a patient perspective, patients love it. It's more in line with the way they engage with so many other services. And so for a lot of healthcare needs, engaging via telehealth makes sense. From a safety perspective, it makes sense. And the other thing that is really coming to the forefront for hospitals is that this is the way forward in terms of revenue recovery, in terms of being able to pull back some of that lost revenue or some of those services from folks that have put off services, a way to get them back engaged. Also means that more clinicians are working remotely and looking for ways to keep clinician workforces outside of centralized spaces unless they have a critical need to be there. But all this means that that telehealth is really on the rise, and so it's not so much a question for most healthcare organizations about do you do telehealth or not do telehealth, but it's really a question about how do you improve and continue to expand what you are doing in telehealth. And so when we look at it through that light, we certainly see most healthcare organizations have, by necessity, embraced video conferencing as a way to have those sort of either doctor-to-doctor consults, doctor-to-patient consults. Many are using more advanced tools that allow for the development of clinical workflows with their telehealth programs. So what does that mean? Being able to actually drive an urgent care situation where patients can queue up and then see the first doctor that becomes available, being able to route a patient from one appointment to the other virtually, being able to take information from a telehealth appointment, push it down to the EHR, or pull information up from the EHR, and tying in your telehealth stuff into your remote monitoring tools, et cetera. These are all things we see starting to happen in telehealth. Also seeing the growth in asynchronous care, so whether that be through texting or whether that be through patient portals, the ability for healthcare professionals to, not just maybe post some results for the patient, but actually have some dialogue with the patient in an asynchronous manner. So the patient can ask a question, they may get an answer later. And the same thing with physician and clinician communications. You see where it's not just, hey, I'm going to get a chart review and then I'll get the results of that chart review, but there may be a dialogue that happens in more of an asynchronous manner. Some of that also has to do with clinicians becoming more comfortable with those technologies in their personal life, and so those really making their way into the healthcare space. Device integration, so really we've already seen a lot of that in terms of remote monitoring or more deliberate monitoring situations, but in terms of integrating devices into telehealth, so you can take those blood pressure readings, so you can actually have the stethoscope and that heartbeat come back for a remote physician to listen to on the other side. Those sorts of things we're seeing in prevalence, certainly in areas that are high risk, such as a nursing home, where you can have a nurse sort of operate the equipment, but still bring that doctor in for a consult. Of course, finally, this all really boils down to patient engagement and really using that technology to meet those patients where they're at. So as we look at all this growth in telehealth and we talk about the expansion of telehealth, what that really means is that as healthcare institutions are looking towards the way forward and they're looking at how they expand their telehealth programs, there's a few different things that they're looking at. One thing is really around encounter types. Another is around those interfaces they use, and the third is ancillary technologies. When we talk about encounter types, it's really expanding the ways in which you can interact with a patient remotely. So those can be things as basic as biometric capture, whether that's self-reported data, or again, we talked about those integrations with actual tools so that you can capture that data and you're getting a richer data set than just the verbal conversation with the patient. Certainly high-end cameras have made it possible that patients can take pretty good pictures if doctors need to inspect things a little more closely. Clinician consults, right? Telehealth isn't just about that doctor-to-patient interaction, but we're seeing a lot more of this where, when you need a consult, a physician can interact with a physician. We certainly see programs where you may have an EMT who, if they are suspecting stroke on site, they're able to leverage telehealth tools to actually reach out to a cardiologist on the way to the hospital, get more information to determine, do they need to go to the ER, do they need to go to some other form of care, but start to make those diagnoses on the way. And then finally, there's steps of care. One of the interesting things, if you look at kind of the expansion of telehealth in recent months, is the adoption by surgery, which is certainly an area, right, we would think of as not being super ingrained in telehealth, but really, but if you talk about your post-op visits, you talk about your pre-op visits, there are a lot of opportunities in those steps of care within surgery that can be conducted on a remote basis. According to Definitive Healthcare, surgery volumes dropped by about 40%, and they're only going to recover to about 80%. So especially in those areas where there is a physical component and clinicians or patients have to come to the hospital, there's a lot of drive to look at how do you how do you minimize the patient stay, minimize the patient's contact in the hospital setting, and where in the steps of care can you push things to a remote setting. Beyond just the types of encounters, this really leads into what do those interfaces look like. So we all know about the video component. We talked a little bit about asynchronous care. Texting is continuing to grow in popularity, and so healthcare institutions are looking for those tools that can enable that secure texting with patients, or basically designing programs that allow for some communications with patients via normal texting tools, and patients, accepting the risks that go along with that. The other thing is data monitoring. There's monitoring of critically sick patients that happens today in terms of remote home care monitoring, but really expanding those monitoring efforts out to population health programs, care coordination programs. There are tools available in the marketplace today, for example, for diabetics, where they can take their glucose readings and those automatically get pushed back into the hospital for their doctor to look at that data. And then finally, as we think about all this, it really boils down to, as you define the modalities for engagement, it boils back down to what's the technology that helps support that. How are you capturing that data? Are you leveraging patient wearables? Are you leveraging those devices that the patient is carrying with them, pacemakers that send back information? But then also, as you're pulling that information back in, do you have the compute? Do you have the network bandwidth to minimize your latency issues, pull that information back in, and actually be able to run that data through your systems? So again, a lot to consider as we think about those expanding the expansion of telehealth, and a lot of different components that organizations are thinking through for their telehealth programs. So the last point I want to make sort of around patient engagement is really just talking a little bit about the fact that we continue to see this growth in how patients are driving their healthcare. Again, that consumerization of healthcare and how they're driving their care like never before. If we, just going on the list here very, very quickly, again, the telehealth growth is really because of patient demand. The new rules on pricing transparency that are going to affect will put more power in the patient's hand to make educated decisions. And what we're also seeing is your Gen Xers and your millennials that are really becoming the decision makers around care. So whether that be for elderly loved ones, whether that be for themselves, whether that be for their children, they're becoming the decision makers, and they're very comfortable with interacting with this technology and leveraging technology as part of the care-making decision process. And so healthcare organizations that are succeeding in recovering revenue are finding ways to engage with those care decision makers. On the right here, I'm just highlighting a few things, really just to call out where patients are really, taking matters into their own hands, right? So medical websites, whether you agree or disagree with patients going and getting their own medical device online, most patients are doing this, and so the healthcare organizations that are winning out are those that are figuring out how to engage with those patients when they're actually looking for answers to their care questions. So whether that be through their own patient portals or through other resources. Patients are ordering their own genetic tests. They're buying their own wearables so that they can monitor some of their own biometrics. And again, what we're really just seeing is this growth of patients driving the care conversation like never before. All right, next I want to talk a little bit about data sharing and some of the trends we're seeing there around sharing data, the continuous flow of data, and how healthcare organizations are connecting into new data sources, what sort of sources they're connecting into. Just talking very briefly about interoperability, certainly that's kind of a buzz term, but this kind of notion of how are different healthcare applications talking to each other, how are different healthcare organizations talking to each other, and how is that data being put in a format that makes it easy for that data sharing to occur without it being these very expensive processes. We're definitely seeing, if we think about API connections, those are really emerging as sort of that standard for how those systems connect. Doesn't mean HL7 per se is going away, but there's a lot of new tools out there, and API is really growing as a standard for connecting a lot of these tools. AI. is another kind of key component in interoperability, and that sort of speaks to the need. We're going to get into AI a bit deeper later, but again, this really sort of speaks to the need that when you ingest this data to figure out what you're going to do with it. And just a couple tidbits on some of the rules that have come out, right? So we've heard about those rules from the HHS that really talk about the requirement that healthcare institutions are sharing patients' medical records with them electronically, and that this is a structure that is no cost to the patient. However, there are things in the rules that do allow for some fees or for some leasing structures of data that organizations are sharing just with themselves. So if we think about analytics tool sets, those sorts of things. So when we think about these trends that are going on from an interoperability perspective, there's a few key things to think about that impacts on the technology side. One is the need for multi-tenancy. As more data is being pulled together, there's a need to have these shared data sets. So this data gets pulled in from different sources, it gets brought together, and you have these large shared data sets, but really there's no one individual that needs to see the entire data set. And so being able to support multi-tenancy so different individuals can do what they want, but the data is in more of a shared format that facilitates interoperability becomes very important. Also think about these high query loads. A lot of data coming in, a lot of data going out, and so the need to support high query loads and be able to run in environments that allow a lot of data exchange back and forth, again, it becomes very critical to enabling interoperability. And finally, what this means is it just puts a lot of demands on infrastructure. Whether you're in the cloud or not, I think the key thing to take out of this is that all this means that there's going to need to be tools that reduce latency and improve speed, or the technology is continuing to improve to support lower latency environments, and continue to improve speed on query results. And so that's a consideration, regardless of where a healthcare organization is going, whether they're still in an on-premise world or they're looking to move to the cloud. Being able to manage those components becomes important as they're pulling in more data into their environments than ever before. So besides data that may be coming from other applications or may be coming from other hospitals, really within the hospital itself, there's just a growing set of data that's coming from medical devices. Certainly we're seeing that continued shift as medical device designers really focus more on the software than the hardware, and it's all about ingesting that or taking that data and being able to store and do stuff with that data. We're seeing a little bit of a merging because of this between information technology and clinical engineering for the medical devices. It's really traditionally been separate, but again, as these devices become more data focused, that distinction is blurring a little bit. And so the last thing I'm just going to call out here on this third bullet is really, fourth bullet, is really the fact that in addition to all the standard medical devices that we see in a hospital that are becoming connected, we're also seeing some big players, Apple, Amazon, Google, that are getting involved in the medical device space. So not just in wearables, but really in some more hospital, some business to consumer type technologies and they're new players in the space, but they think the mindset that these companies approach medical devices is very different, and so they're very data first, right, in terms of how they position those devices. So a couple things to really call out around this. One is all this data means that the need to figure out how to consolidate into a medical device database becomes that much more critical. And to take all these different data that may be coming from different devices, but are all monitoring the same patient, but pull those together, correlate those appropriately, and store that information appropriately for further analysis becomes very important. Other thing that becomes really key is the networking aspect of that. So it's not just the patient getting on their own phone or being able to watch television that's driving the network, and it's not just the nurses being able to walk around with their tablet and connect to the network to pull up their own applications they're working on. All these medical devices are also connecting into the network and pushing data up into the healthcare systems environment. And so when we think about kind of how the network's architected to support the continued growth of all these devices, really working through those challenges, figuring out how to best architect your network and having that architectural plan to ensure that you're maintaining your security, reducing your latency, becomes very critical. So next, the slide doesn't have a lot of info on it. I'm just going to talk a bit about home health data. So that becomes another source of information for the healthcare setting. 51 million. What that represents are the projections of patients that were going to be home monitored in 2020. And this projection is actually from December of 2019. So it's really interesting. This is a pre-COVID number. So no doubt this number has exploded that much more since really a lot of care has shifted more into an off-site situation as much as possible. So I'm just going to pull up a slide here, just kind of talk a little bit more about home health. And so there are some care scenarios that maybe pop up very apparent in people's minds when they think about home health. But we really are seeing that, again, the nature of what can be done out of the home and where patient data is being pulled from what they're doing in the home is expanding. So just a couple examples I'll give here, one around digital therapies. I talked a little bit more about you may have a patient, a diabetes patient who's monitoring their own glucose levels. We're certainly seeing where those readings are being pulled back. You may have a device that connects into the patient's home internet. It reports the data back into a central repository where an AI is running an algorithm. And so now you have glucose monitorings from a patient or a cohort of patients that's being monitored. The AI is able to look for trends when there's potential negative care events. So maybe where the patient's having to be admitted for low blood sugar into the hospital. And the AI is able to turn that around and trigger care coordination for those sorts of events. So when the data points are pointing to a higher than acceptable risk, whether that you're triggering a nurse outreach at that point, or whether you're actually triggering some patient education to be for that patient, whatever the appropriate outreach is, it's really being driven by that data that is now not just data that's being collected at the hospital, being collected in the patient's home. Another example here around voice technologies, if we think about Amazon Echoes or those sorts of smart home devices that are becoming more prevalent in the home. Amazon Alexa specifically has a skill, right, where it can remind patients about taking their medication. And the next step really with that is taking those reminders, getting the patient's feedback, and using that to track medication adherence. And really it goes back to the same thing, right? You report that data back, and now hospitals are able to create more real-time and more meaningful interventions with their patient populations. So when we think about all these wearables and all these different devices, from a technology perspective, it's really important to think about how that data is being ingested back into the system, and really data being ingested in the system that may not be originating from a secure source because it's originating from a patient's home, but how is that getting pushed back to those central hubs? How is that secured? And then how is that getting pushed in the hospital setting? But I think it's important to note with all this, patients are collecting this information on their own already. And so it's less of a question about how do you secure the connection to the patient, but more about how are you leveraging that data set that they have opted into collecting. I do want to talk a little bit about security though, and really just if we think about data security, that still is a critical issue in our healthcare environments today. So, some of the things I'll really just call out, ransomware attacks, malware attacks continue to be on the rise. Those are really driven by the preponderance of data that is in the healthcare environment and how critical that is to driving care situations. The other thing is, we talked a little bit earlier about medical devices. Obviously, all those new devices connecting the system create new avenues of attack. We talk about interoperability, all those different applications and other healthcare institutions that are building connections to each other or to HIEs. Those create new vectors of attack for malware and ransomware. And so on the left here, really have what I would call a lot of those, block and tackling activities. You got to make sure you're doing multi-factor authentication where it makes sense. Make sure you're updating your firewalls. Make sure you're doing your patching and upgrading. But the one thing I'll call out here that becomes really critical when you think about all these new vectors of attack is making sure that you have robust penetration testing. And so we see the criticality of that growing, right? So as there become new vectors of attack and as the number of devices and entryways into the environments continue to increase, continuing to go back, check, verify that the environment is still secure and that there hasn't been a ransomware attack becomes very, very important. Certainly, I think a lot of healthcare organizations are looking into their security now, having just stood up a lot of things in a hurry to keep the hospital operational as during the heights of the pandemic. So just real quickly, I pulled this last slide in from Open Data Watch. I personally just, it's a little bit busy, but I like this slide. I think it does a good job of kind of just talking about the data value chain, which is really, if you think about taking that data, pulling data in, using that data to garner insights, validating what the usefulness of those insights are, and then adjusting how the data is used or reused. It's essentially kind of a PDCA cycle for the data value chain. And it's a great segue into my next topic, which is around maximizing data usage. So I'm just going to talk a little bit here first about merging data sets. So that really is the critical challenge with this, right? We've all heard that old adage, drowning in information, but starved for intelligence. And it's very true in the healthcare setting. There's a lot of information, and with ingesting information comes some liability because you have access to this information. So it becomes that much more critical that care providers are able to make use of this information. And step one is really that the information can't continue to be disparate once it comes into the healthcare environment, but it really has to be merged into a unified data set. So I do have an example. I'll just go over really quickly. This example is more around research, I'll say, than for a specific care use case, but the principles still apply, and that is if you look at patient data that may be coming from multiple primary sources, you may have the actual data out of the EHR, you may have some operational data that you're tying back in that talks about how certain clinical procedures are performed or how certain back-end operational processes are performed. You may have financial data that really talks through the profitability, the risk of certain care activities. Merging all that data together gives you sort of a broader picture and helps inform what's working and what's not working for both given patients and for given cohorts of patients. And so being able to take that data and create meaningful insights out of it, in addition to being able to pull in data that may not traditionally be in the patient's record or may be sitting out in other patients' records, becomes really critical. So I just like this quote. I wanted to put it up here, really talking about AI, the potential to markedly improve productivity, efficiency, workflow, accuracy, and speed for both physicians and patients. I think one of the key things that to call out with this quote is that it really talks about augmenting human performance, right, through AI. And so there does tend to be some concerns about AI and the role it plays in taking away people's jobs. And certainly AI does not replace clinical decision making or those physicians being able to make those clinical decisions. However, what it does do is it really does enable that better decision support. And when we look at the copious amounts of data coming in, the importance of being able to leverage AI to make sense of all this data just becomes critical. So on this slide, just talking through a few areas of growth in our artificial intelligence. So radiology, I think most people are aware of, revenue cycle management. But really, we're seeing good growth in some other areas: pathology, risk stratification, monitoring, and you're seeing it used for predictive analytics. And then patient triage, using AI, especially if it's tied into your population health programs, to more smartly route patients that are calling into urgent care and to figure out where they need to be placed, or to ask them some questions on the phone to figure out, is this truly an emergency? Do they need to be seen right away? Is there advice they can get without to go ahead and start solving their issue before they actually even see a medical professional? So thinking through implementing artificial intelligence, there are certainly a few challenges that emerge. The first couple of these, think about clinician buy-in. If we think about data use case, these are really problems that they're non-technology problems, right? So getting the clinicians bought in is certainly important. Defining a really good data use case, so rather than saying, oh, we've got AI, now we're just going to implement it, but understanding why you got the AI, what problem you're looking to solve is very important when organizations can start with AI. The other problems or challenges really do tend to be more technology driven though. So how do you connect in all the data that you need to connect in? How are you making sure that data is clean? And if you're connecting together multiple data sets, how are you making sure those data sets are connected appropriately? And then when you talk about pulling in this data, allowing the AI to make calculations based on that data and spit out appropriate insights, how you make sure that you have the right compute resources dedicated to it to get the job done and get it done in an efficient manner. So again, things to be thinking about in terms of artificial intelligence programs and maximizing those data use. All right, so last thing to talk about here is around maximizing clinical data maximizing your data is really around clinical data access. And so what I'm really talking about here are the ways that clinicians access the data. Again, we talked a lot about telehealth. I'll bring that one up as a primary case in point. Clinical professionals are able to do those types of consults via telehealth, and so it's no longer getting access to a specialist no longer is just by someone picking up the phone. Those can be scheduled through telehealth tools where charts can actually be pulled up, data can be shared back and forth in real time, or you can have an asynchronous but near real-time conversation with a physician. And what that really means is that a specialist can be enabled to be more productive and have meaningful conversations with primary care physicians in multiple states, or in a day, they can have bits and pieces of those conversations spread out more asynchronously because of some of this telehealth technology. The other thing that becomes really critical here is if we talk about the fact that a lot of care is moving out of the hospital, the need to have your clinicians in the hospital in some cases reduces as well. And so this whole notion around remote access, how are you managing your workforce remotely, and how are you managing your clinicians remotely, and making sure your clinicians can be productive remotely becomes very important. The last thing I'm just going to call out here is around mobility. So and that's what I'm really talking about here is mobility in the hospital and the shift to mobile devices. So we see most nurses today are using tablets or other mobile resources to interact with patients in the hospital. So the 77% number, patients are very comfortable, that they think positively about their clinicians coming in, bringing the technology. It's actually a step up, right, from the doctor that literally had to turn their back on you to type in the terminal that was sitting near the bedside or sitting in the doctor's office. But being able to do this stuff on a tablet enables more face-to-face communication. But again, there's networking challenges that come with that, and there's security challenges that come with that. So ensuring those devices are secure, especially if you're allowing a nurse to use their own smartphone in some cases, especially if they're working off-site, and making sure that you have good virtual desktop programs where you can present all the applications the nurse needs to do their job, and also making sure that you don't have latency issues as the nurse is interacting with that interface and pulling up all that data that they need to interact with the patient. And I'm saying nurse, physician, whoever the case may be. But so again, a lot of the trends we talked about today, we've really just been discussing, the complexity that gets added to the back end infrastructure within the healthcare environment, and the need for IT to be able to be on the forefront of helping clinical operations make the right decisions about how to implement technology, but still have their back end supported. So I'm going to pass the conversation over to Joe, just to talk a little bit about managed services and how leveraging a managed service can help alleviate some of the pressure on the IT department so they can shift their focus to what really matters. Joe?
Hey, thanks, Brett. Yeah, as Brett mentioned, I'm Joe DiMartino. I'm a practice director within Advizex Managed Services. Myself and Alywn Santos, who's a peer of mine, we're going to take you through how our managed services can assist your organization to be able to support some of these trends that Brett has discussed. We're only a couple slides, but we thought it was very important just to, go over kind of where we see where we can assist you and where we've been assisting some other clients. So this slide here, this is a quick overview of our managed services. It really represents the different domains we can assist with. So I won't go through each of these, but we support anywhere from cloud to network, virtualization. But the important thing is, regardless of our technology and domain, our delivery model, our people, our processes and tools, they're consistent across each. So consistencies are important for streamlining operational services. Our managed service is 24/7. 365 follow the sun, remote monitoring and management support. So we're working issues and incidents any time of the day, and monitoring and being there for your environment, regardless of time, day, holiday, weekends, or just filling gaps for your environment and coverage. We can provide. Brett, just go back a little bit more. One more.
Yeah. Oh, sorry.
Okay. Yep. No, we can provide our service regardless of location and deployment model. So on-prem, off-prem, cloud, hybrid model. As long as we can connect to it, we can provide our services. And then finally, our service is SLA back for response times, which is critical. 15 minutes for response for urgent issue. We're going to be working that within 15 minutes for your environment. So it is SLA back for response. Early in the presentation, Brett did allude to several trends going on in healthcare. So I'm just going to hit upon a couple of where I think Advizex can assist you and stay very high level. So Brett, you can go to the next slide. So what we have here is our network managed services. I'm not going to read bullet point here, but this is to kind of give you an idea of a sample of our service catalog for our network managed services. This represents both proactive monitoring and the day-to-day operational tasks that we'll provide. Really, our service is developed to monitor and track items like latency issues, thus being proactive before an issue arises on your end. As an example, this type of monitoring is key, for ensuring, like Brett talked about, telehealth and clinical data access demands can be delivered without latency issues due to us being ahead of the curve and doing proper planning and monitoring key metrics so we can do performance tuning on a daily basis. Our service will enable the organization to prepare you for the growing number of medical devices that healthcare are seeing added to their network. This is accomplished by ongoing capacity planning, routine performance tuning, architectural recommendations based on historical trends and data that we're capturing via our monitoring and log sets. The other thing regarding network managed services, and again, this can go out into operating systems and databases, but we're ensuring security standards are met for your connected devices. We can manage the policies set forth by your organization, and by completing routine patching to devices to address the vulnerabilities. We all know any devices, operating system, databases, there's always new updates coming out to address such things, and we can do that as part of this process. As a note, also, we hold weekly status calls. We can change the cadence for what's comfortable for each of the clients, but during this call, we're discussing open and closed tickets, as well as providing ongoing recommendations based on the data that we are collecting from our tool sets. More specifically, we'll review trends in items like latency, capacity, and many other key metrics that will contribute to ensuring that your network is healthy and can deal with most of these trends that Brett alluded to. So that's the network. You can go on, Brett, one more. So I wanted to hit upon our virtualization digital workspace. You know, Brett did mention being able to have free access, not free access, but roam around from different locations. So I want to hit upon this and show you how our Advizex can support this. This slide represents our offering around virtualization, both host and desktop, and then services around maintaining a digital workspace that the healthcare organizations are adopting. So the services here are developed to really remove the concern of accessibility and reliability that physicians and clinicians have in terms of being able to access their profiles and the applications from anywhere. So this service really is to really take that out of there and make sure that we're ready to, when doctors or nurses log on, they know that profile is going to be there and they know it's accessible. So our proactive management, our managed services here will enable physicians, clinicians to work within or outside of the hospital to deliver services regardless of location. As an example, making sure that the telehealth environment and clinical collaboration can occur because of us maintaining the profiles and accessibility. Our proactive monitoring and management enables the clinicians to move freely via their devices in the hospital by us ensuring their digital workspace is accessible from wherever they are. This is accomplished by us completing ongoing health checks, performance tuning of the environments, thus ensuring they're running their peak performance. And staying ahead of the curve is what we see is most important for clinicians is preventing the issue before it occurs. So that's a couple quick, like I said, a couple quick slides on our network virtualization. We have service catalogs for each of our different technologies that we provide. But I'm going to hand this over to Alywn Santos, who's going to go into more detail around the database services and how he can assist with the trends of merging data sets. Alywn?
Thank you, Joe. Like Joe said, I'm the practice director for the database side of the cloud managed services side of the house. So where do we come in? Underneath that application, whether it's Epic, NextGen, or something else, right, is a database, which obviously runs on your infrastructure. Who's managing and keeping that up and running? What happens if it goes down? Do you have a business continuity plan? Is your data secure? Or better yet, is your data encrypted? Is your application running efficiently? These are questions you need to ask yourselves. And if you don't know the answers, this is where Advizex Cloud Managed Services come in. Our role as your managed services provider is to take away your headaches and pains. We will be your direct response, and we'll make sure your environment's up to par with our standards and best practice. So how do we accomplish this? Your environment, servers and databases, network, like Joe said, will be monitored by our proprietary tool called Advizex. This tool provides technology which facilitates for tracking your needs, customer needs, recording content, activities performed on your behalf, and warehousing of statistical configuration and performance information of the servers, databases, and whatever we monitor and support for you. So, for example, if a particular screen is running longer than normal, i.e. Pulling a patient record, Advizex will be alerted about it. So our technicians can get on the keyboard and determine the issue and address it. You won't even know this is happening. We'll get the ticket and we'll address it for you. If a disaster happens, we will be there and make sure you are switched over and failed over to your HA site, hence ensuring continuous business, avoiding downtime, right? Advizex will monitor your uptimes and keep your certified releases up to date. You will not be behind on versions, obviously pending certifications with your application that you're running. So we will be there 24/365, regardless. Brett, next slide. So if you see yourself listed on the left-hand pane, please engage with us. We can help. Not only will you get our proprietary Advizex tool, but you will also be provided with a team who will know your database and servers and environment. That team will work with your team and be your liaison with your application vendors. This is important, so you know that any releases are certified by your vendor, your application vendor. Again, let us worry about the back end, and you just run your business as normal. Because of the importance of security and compliance with privacy laws as well, we have trained our staff for PHI and HIPAA. And if there are other compliance laws that your business require, we will take them. We want you to be confident that your data is secure with us. Our folks have an average of 10 to 15 years of experience, so you are not getting a rookie. We know what we're doing, and we've been around the block a few times. And talk about customer retention, we keep them. Once you become a customer, they're happy and they stay with us. Brett, next slide. Okay, I thought there was some. So this is just a sampling of our many satisfied healthcare clients. I won't go through each and every one of these. It's not a complete listing.
Alywn, well, this slide here is our technology partner. Sorry, we do have our next slide.
Oh, sorry. I got it backwards. So yeah, here is, it's not a complete list, but these are the main Advizex ones that we have partnered with. And if you go to the next slide, I believe that's the healthcare customers, right? Yeah. So Brett, back to you, so you could wrap this up.
Thanks, Alywn. So we're just going to go ahead and just take a couple minutes for questions here. If anyone has any questions, I think you can post in the chat box. And I did have a question that came in earlier around we kind of talked earlier about health equity, and a question come through around, if you look at a lot of these technology trends, how are those being addressed? When they require the patients to have access to the technology, and what I'll say there is, what I'm seeing in a lot of healthcare institutions, and certainly if you look at kind of where some of the funding, this CARES grant funding has gone, you actually do see healthcare institutions that are leveraging that grant funding to actually provide technology out to their disadvantaged patients that need access to those applications because they have chronic conditions or some of their higher at-risk patients. So would that be actually, getting them access to more reliable Wi-Fi? There's a program via Comcast that helps do that in low-income households. There are tablets that hospitals are actually issuing out to help with some monitoring, or they're issuing out the monitoring equipment. So certainly still a lot of work to be done around health equity, but we are seeing some hospitals that are leveraging grant funding to help address some of those health equity concerns. If you're interested in finding out more, there's a great study out there by the Alywn Institute out of Massachusetts that recently came out with their hospital rankings, and it's interesting because they don't just include outcomes. Their rankings actually do include a measure of health equity in their reading. So might be a good thing to go check out your own hospital and see sort of where they rank, and just it's good data to have. Okay, so I'm seeing another question that came in here, and it's asking, how do you ensure with your managed services that data is remaining HIPAA compliant? So Alywn, I'll pass it over to you if you want to.
Sure. So really, the application vendor that we deal with most of the time have documented compliances with the third parties and such as customers like you, right? So we, from the back end, we need to enforce that, right? So for the database, really the only way to do that is to encrypt all the health data, whether it's at rest or in transit. And we need to make sure that that is done. Also with your backups, we need to make sure those are tested and securely stored. and again, encrypted. Your infrastructure, we need to make sure that from Joe DiMartino's side, we need to make sure that it's also in a high security infrastructure that in itself needs to be fully HIPAA compliant. That's why we partnered with a lot of cloud vendors like AWS, Oracle, and that, because we know those are already compliant. It could be in-house, meaning at your premise or in the cloud. We can even dedicate an availability domain just for you. That's available nowadays. And we sign BAA agreements, so we know that PHI is very important. So we need to make sure that we have an agreement between both parties. I hope that answers that question.
Yeah. Thanks, Howard.
Yep.
Any other questions? Okay, I'm not seeing any others coming through. So, and I know we're almost at time, so we'll go ahead and wrap up. So, for folks on the call, you should be getting a survey right after this call that will also include the link to get your $25 Amazon gift card. So again, appreciate everyone for jumping on today, and hope this content was helpful. And everyone have a good day.
Thank you, Brett.